Hello, I am live. I am reading out of Many Lifetimes. I've just finished chapter 6. This is a collaboration between Joan Marshall Grant and her then husband Dennis Kelsey. She passed away in 1989. This is about hypnosis and therapy. They were both hypnotherapists. We are here at chapter 7, which is written by Joan Grant, The Age of Perception. The first time I noticed how clearly the newborn reveal their essential character, even to the amateur eye, was on the 22nd of April 1952, the day Gillian had her first baby. The private rooms of the hospital opened on a wide corridor in which the infants were parked in cots outside their mother's doorway, except at feeding times. Inspired by grandmotherly interest, I inspected a row of about a dozen. The first 3 or 4, who were all over a week old, had a surprisingly wide range of physical appearance, yet still looked just like babies. The next one, born during that night, was an exceedingly malevolent man, glaring at me from an infant body, so malevolent that I felt it would be a service to humanity to throw him out of the window. However, had anyone done so, he would have foisted himself on some other unfortunate couple, if not on the same parents, within the minimum period. I happened to mention this incident when lecturing in New York, and afterwards had expert confirmation from a member of the audience. She was the sister in charge of the obstetrics theatre of a large hospital, a post she had held over 20 years. Even during her midwifery training, she had noticed that the infant reveals its basic characteristics immediately after birth, although after a few hours these ceased to be so clearly discernible, until several weeks or even months later. She told me that she had found it difficult to conceal from mothers who had produced exceedingly unpleasant individuals that she knew they deserved condolences rather than congratulations. She had made detailed notes of every baby whom she had thought would be outstanding in any particular direction, and kept in touch with their mothers, so that she could check her observations. She had proved correct in such a very high percentage of cases that it could not be dismissed as coincidence. Her empirical conviction that the character of an infant is formed long before it is born, and has a range which cannot be accounted for by intrauterine experience, had caused her to have complete certainty of the validity of reincarnation. The reason why it is easier to assess the character at birth than during the subsequent weeks is that the ordeal mobilizes aspects of the personality, which will scarcely be in evidence again until the infant's field of choice begins to broaden. But should the body be in danger, these aspects may be remobilized. It is not only dehydration which sometimes causes a baby who is ill to look so old and wise. The ability of this talented theatre sister to judge the basic characteristics of the newborn would have been put to full use in a more enlightened culture. For instance, in early dynastic Egypt, she would have been one of the experts who, whenever possible, were present at a birth, so that the parents could be advised as to which aspects of their child's personality should be encouraged to flourish, and which aspects they should help him to change. For it was then recognized that the earlier he began to change his unhealthy attributes, the easier it would be for him to do so. Nowadays, any curative procedure directed at trying to help a baby or even a small child to change his ominous attitudes is usually foiled by the protest, "But he's only a baby, he's too young to understand." The real nexus of the problem is that unless he is taught how to redirect his energies, while the acute perception of infancy is still relatively unobscured by brain function, his re-education will be far more difficult, both for himself and everyone in his environment. that it need have been. My ability to recall episodes from my current life's infancy without the aid of hypnosis is not a side effect of the far memory faculty, and I'm sure that similar recalls could be done by almost anyone. But any form of recall requires the genuine wish to accept full responsibility for the experience, and will not occur when the motive is to search for some convenient scapegoat. It is always painful to remember the virtues one has discarded, the abilities one has failed to employ, the insight one has failed to use, yet this can be very salutary, for it reminds one that all these attributes which one had when an infant can, if one chooses, be rescued. I believe the reason so few patients produce therapeutic recalls during orthodox analysis is because they have been led to expect to find that as infants they were a horrid little bundle of antisocial feelings orientated towards scatology, patricide, mum rape, and sibling slaughter. Fortunately, in the vast majority of cases, such fantasies are born only in the minds of their analysts. I'm going to recount a few episodes from my early childhood because I think they are typical of most children, and illustrate the normal child's power of observation, his ability to work out a plan and carry it into effect, and the insight which allows him to see slap through the pretenses with which grown-ups contrive to conceal themselves from each other. I think that if the perspicacity of the so-called innocents were more widely recognized, they would be taught how to use this I've got to look that up, perspicacity to good advantage, and they would also be unable to misuse it to make fools of their unfortunate parents. The earliest decision I can remember making was when I refused to suckle, although I was by then becoming exceedingly thirsty because I had already several times rejected my mother's breast. The smell of her milk was nauseating, the reason for this instinctive reaction probably being that in it I could smell the drugs from which I had suffered during the fetal period, drugs which she took to combat severe attacks of asthma. I remember acute despair when I was offered a bottle only to find that it contained the same repugnant fluid. By this time I had a raging thirst and craved for water. I also remember the tremendous relief I felt when I was offered a bottle which contained a formula which later I identified by the smell as Mellin's food. I think it extremely probable that many of the infants who refuse to suckle have the same instinctive recognition, that the mother's milk contains some constituent which has either caused them discomfort or been actively dangerous to them during their fetal period, so as there is an increasing tendency for pregnant women to be given tranquilizers and other drugs, whose effect on the unborn baby is not fully understood. It is exceedingly important that the infant's natural desire to protect itself from an additional dose of something which has already proved unsatisfactory should be recognized and accepted. If an alternative form of nourishment is withheld, its protective mechanism will become numbed by hunger, or rather numbed. Why is this already empty? During my first 4 months, I had the good fortune to be looked after by an old-fashioned maternity nurse, with whom it was very easy to communicate. She at once recognized the noise I made to indicate I wished to unload, and so provided a pot, tapping it with her finger to draw my attention to its convenient presence. Perhaps she learned this helpful technique through having handled many infants, and so knew that it is much easier to house-train them during their first weeks than it will be when they are older. Or she may have acquired this item of insight when belonging to a tribe who carry their infants on their backs. Such a mother, as I know from personal experience, takes the trouble to remain alert to signals from her infant. Otherwise she will suffer the discomfort of hot trickles down her spine. Whatever the source of her expertise may have been, I benefited from it exceedingly, for instead of having to endure the misery of soaking diapers, I never had to wear one after the age of 6 weeks. My mother, who was very properly considered that every infant should have received similar servicing, used to infuriate parents of my generation by saying, "But your baby has wet itself, how very extraordinary. To look at it one could not have guessed that it was mentally deficient." I tried to explain to her that modern theories of baby care maintained that terrible traumata were caused by early potty training, to which she briskly replied, "Well, if the parents are silly enough to believe anything so idiotic, I suppose one can only tell them that they should have been prevented from breeding." When the maternity nurse left, she was replaced by a nanny, and on the day she arrived I was taken to a furnished house, which my parents had rented for the month of August 1907. I have been born in that same year on the 12th of April. Hoping to make the changeover easier, my mother decided to give me my bottle, which I indignantly rejected, because it resonated me to being offered her breast. One must remember that in those days parents seldom handled their offspring, and would no more have thought of bathing their baby than of doing the washing up, or of feeding it than flustering the cook by invading her kitchen. Not only had I been suddenly bereft of the only person with whom I could communicate, but all bottles were now suspect, for they had again become associated with the initial ones which had contained mother's milk. So the only course open to me was to refuse to accept anything unless it was offered in a spoon. Spoons had proved safe, as they contained water when I was thirsty. As I became increasingly hungry, I thought of a spoon with growing desperation. Its shape and colour and the feel of it touching my mouth, I beamed spoon at everybody who came near me, and their failure to understand scared me, for it was very alarming to be at the mercy of bland giants who seemed so utterly stupid. I was at the point of allowing myself to be poisoned when a visitor suddenly understood what I was trying to convey. She told them to feed me with a spoon, and never before since has a meal been quite so delectable. I was able to check the date of this incident and the accuracy of my visual observations. I happened to mention to my father, some 12 years later, that I could remember a few events which had occurred before I was 6 months old. He asserted that this was impossible, because my brain would not have been yet sufficiently developed. So I described the room which had been my nursery in considerable detail, the relative positions of the door, windows, and fireplace, and a semi-circular corner turret. I also recalled the colour and patterns of the wallpaper. I knew that the nursery was the second door on the left at the top of the front staircase, and that there was a window with blue, red, and yellow panes on the landing. Fortunately, Mother remembered that I had gone on a hunger strike when I was 4 months old, and also that it had taken place in the house we had occupied only during that August, to which none of us had been before or since. My father, impelled by a spirit of scientific interest, took the trouble to go to the house to check every assertion. The new owners were delighted to let him see over it, but must have been rather startled when he asked their permission to strip off a piece of wallpaper from the recently decorated room, opening from a landing which was lit by a stained glass window. Under the new paper he found another, but this bore no resemblance to the one I had described. However, he persisted with his investigations, and the next layer of paper was identical with the one he hoped or feared to find. The wallpaper is relevant in another context. Even at 4 months old, I considered it painfully ugly. I used to stare at it in disgust, wishing my cot was closer to the window, so that I could watch leaves moving, or the shape of branches against the sky. I used to wonder why the walls of a room had such an uneasy pattern, such harsh colours, and such a horrid texture, for I could touch it by stretching my hand between the bars of my cot. I will stop this here because my battery seems to have drained already again. Today is Tuesday, and it's the 17th of September 24.